Hello and welcome to the Nurse Station. I'm Maria Mobley and we are currently in this mini series where I post a question, you pause the video, you break down the question, then I'll show you how I break it down. And I've already posted 2 questions and it seems to be helping, and if I can help one person, I'm gonna keep doing it. And I just encourage you, if this method doesn't work for you, just have a way. Every single style of questions, there's many different types of questions you're going to see on Next Gen NCLEX. They have different strategies or different ways you can break them down. So if this doesn't help, I always tell my students, you don't have to agree with me. This is just the answer I would pick. I just encourage you to have a way, okay? So pause that video, break down the question, and then I'll show you how. All right, with this, and this is who do you see first, right? You just got shift report, you gotta prioritize based upon highest acuity, what patient you need to see first, okay? Maslow's is a part of everything we do in nursing. And how I break down these questions, I want y'all to think unexpected versus expected. That's how I do it. Some people say complication versus manifestation, but I want you to think about this. You are in the NCLEX perfect world. If there is a diagnosis, aren't we already treating them, right? If they're diagnosed with diabetes, aren't we already treating them? If they're diagnosed with a myocardial infarction, aren't we already treating them? So that's how I want you to think about it. So when you see a diagnosis, your highest acuity patient are these symptoms that are unexpected, right? If we have a diagnosis, we know how the disease traditionally presents, and we also know the evidence-based practice treatment. So it's a perfect world. They're getting the treatment. So I want you to go to unexpected symptoms if they have a diagnosis versus expected. If you expect to see those symptoms, they already are diagnosed. In the perfect world, they're already being treated. Why are we running to that? We should not be going to that. Now, a caveat to this, if they have no diagnosis, every symptom is unexpected. Right? If they don't have a diagnosis yet, we don't know how to treat it, every symptom is unexpected. So how I break down these questions, I go to unexpected symptoms over expected symptoms, and then I see what symptoms are unexpected, and I label it according to Maslow's. Is the airway, breathing, circulation? I pick highest according to Maslow's. So if you look in the video description, I have a link to my video that goes way more into detail, but let me show you how I'll do it. So upon receiving bedside shift report in the cardiac care unit, which client should the nurse see first? Again, in the real world, these are our patients. We have to see all of them. The NCLEX is just trying to see, can you prioritize? So who is highest acuity and who should you see first? Because in the real world, we do need to see patients that need immediate attention before patients that might not in that moment, right? So like I said, if they have a diagnosis, we're gonna go to unexpected symptoms. Or I'll write it a different way. I want you to think, go to a complication versus a manifestation, okay? Y'all are like, how did this woman become a teacher with this handwriting? I don't know. But I say unexpected versus expected. You might say, go to a complication over a manifestation of a disease. However you want to break it down, okay? So let's look. The client diagnosed with a myocardial infarction, so they have a diagnosis. They have had an MI. This is the perfect world. We have very, very effective treatment for heart attacks, right? Like it's evidence-based. When they hit our emergency department doors, we know what to do and how to do it. Whose morning troponin levels are elevated. So I'm going to ask you, elevated troponin levels, right? The lab value that is showing you damage to the heart muscle, is it expected to be elevated with a diagnosis of myocardial infarction? Absolutely. This is expected, right? I'm going to expect to see that. Now, the client diagnosed with hypertensive urgency, so this isn't crisis yet, but we know hypertension, right? Elevated blood pressure. Is it expected for them to have a blood pressure of 174 over 96 millimeters of mercury? I'm going to say it's expected. It's literally a condition where blood pressure is high. So it's expected. I'm not too concerned about that yet. And I'm not saying I wouldn't see these patients. I'm just going to try to find a complication over something that's expected, okay? The client diagnosed with PAD, whose bilateral dorsalis pedis pulses are weak and thready. you need to know the difference between PAD and PVD, right? Peripheral venous disease, peripheral arterial disease, and how it presents. I have a good video on that too if you need help with that. But with arterial disease, it's absolutely expected because the lack of blood flow is getting to the foot, right? You got to think about where the buildup in the vessels are. So it's expected. Sometimes they have absent pulses, right? And we have to get a Doppler out to verify blood flow and things like that. But this is expected. I wouldn't run to that. The client diagnosed with hypertensive urgency, so we got another hypertensive urgency, who cannot move the left upper extremity when asked to do so. You go in, you're doing your assessment. Of course, we're so concerned this will turn to crisis and show potential other organ involvement, right? They now cannot move an extremity when asked to do so. To me, this is unexpected. Like, this is not a manifestation I expect to see with hypertensive urgency. So I would label it unexpected. And I don't see any other unexpected symptoms. So I can eliminate by process of elimination. And this is who I would go to first. So again, I have a much more detailed video because there's some caveats to this, y'all. If you have a diagnosis and your symptom is expected, but that symptom is life-threatening, you got to go to it. If we have a diagnosis of anaphylactic reaction and they're having tongue swelling, that's expected, right? Can be a symptom, but that also can take away their airway. So watch the video for a much more detailed explanation in the description, but this is how I would break down this question. So I'm hoping it's helping. If not, I just encourage you to have a way. And remember, you don't have to agree with me, right? I just am trying to give you tools to be successful at taking tests in your nursing program and also to be successful in the Next Gen NCLEX. As always, we are better together. If this helped you, please help somebody else. Take care.